President Trump making an announcement linking Tylenol use during pregnancy to an increase in autism cases due to the active ingredient acetaminophen used in the over-the-counter drug.
Tylenol during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary.
Joining me now is special needs advocate and the parent of an autistic child, John Featherston, and cardiologist and internal medicine physician, Dr. Payal Kohli. Good morning to you both. Thank you both so much for joining us. Doctor, I'll start with you. What do you think about the president's announcement yesterday?
You know, I have to say that I want to commend the administration for looking into increased causes of autism, which we know the incidence of autism has been increasing in recent years. But we really have to be careful here interpreting the science, because what the science has shown us is an association between the use of acetaminophen and increased risk of autism. Now, note that I said association and not causation. So what I mean here is we're not clear if Tylenol is just a marker of something risky, like a fever, an infection, a migraine, or something else, or Tylenol is actually involved in the risk. And the challenge here really comes from the fact that it's hard to study pregnant women because it's not ethical to randomize them, which is what would establish causation. So there's certainly a link there, but I think we need a lot more science to figure out exactly what the nature of that link is.
John, as a parent, what are your thoughts on this?
You know, good morning, Carly. I'm just thankful after 27 years of my family dealing with autism, we're able to have this conversation. And I think this conversation will lead to positive developments in this thing, because, you know, little kids with autism grow up to be adults with autism, and they fight, you know, this battle for the rest of their life: transportation, housing, job stability. I'm just thankful for the opportunity that we can talk about this on the national scale this morning.
Dr. Kohli, the parent company of Tylenol has rejected the claims made by the Trump administration, saying, "We believe independent sound science clearly shows that taking acetaminophen does not cause autism, and are deeply concerned with the health risk this poses for expecting mothers. The facts are that over a decade of rigorous research endorsed by leading medical professionals and global health regulators confirms there is no credible evidence linking acetaminophen to autism." And one of those studies was conducted just last year. It covered nearly 2.5 million births in Sweden, and it found no increased autism risk when exposing children to acetaminophen in the womb. So, doctor, with that in mind, where do we go from here?
You know, I would say it's complicated. The science so far, it's probably inconclusive. I wouldn't say it's definitive one way or the other, but I do feel very comfortable based on the decades of data that we have, telling my pregnant patients that they can use acetaminophen safely in the shortest duration possible for the shortest dose, because we know that not using it and exposing the baby and the placenta and the mom to fever, to infection, to pain are all bad things as well. And the Swedish study that you talk about from last year with 2.5 million kids, what was really interesting about that is that they used what's called a sibling control, because we know autism is complicated. There's many factors involved, including genetics and environmental exposures. So they compared two siblings in the same family, same parents, presumably same environmental exposures, and one got exposed to Tylenol, one didn't, and then looked to see if there was a difference. So I think the science is still evolving, but in the meantime, the American College of Obstetrics and Gynecology, the Autism Science Foundation, many others say we don't want women to be afraid of using Tylenol, because the pain, the fever, the infection, that could also be harmful for the baby as well.
John, are you hopeful that with this level of attention and focus, that real progress can be made?
That is the goal, Carly. I mean, like I said, national spotlight on this. You know, I don't pretend to know what causes autism. I lean towards environmental and the pacing of the vaccines. But let's just investigate this and try to find out, because there are so many families that are struggling with this, and conversation is going to lead us to positive results. So I praise the administration for having this conversation.
And President Trump called this the biggest medical announcement in the history of our country, so they certainly are making it a focus. John, Dr. Kohli, thank you both so much for joining us.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.